For range of motion testing, the most common test to use is called the Faber test. It's an acronym for flexion, abduction, external rotation. Now, we've tested the unaffected side first, so we're theoretically, we are moving to the affected side. We're going to have her flex her hip to 90 degrees, bring her inside of her foot to the inside of her opposite knee, and drop the leg out, like so. Sometimes this position will cause pain, and we're especially looking for if she can pinpoint where the pain occurs, either somewhere along the attachment on the pubic bone or somewhere down along the myotendinous junction of this group or somewhere in the muscle bellies. If this position is not painful, you can ask her to actively pull the leg farther closer down to see if that creates any painful symptoms. And come back. For the resisted portion of the assessment for adductor strain, we can come back into the Faber position, flexion, abduction, external rotation. And now I'm going to ask Sammy to try to bring her knee up against my hand as if she's pushing toward the ceiling. This is resisted adduction, and we're looking for increase in pain, and if she can pinpoint where the pain occurs. And relax. We could also do a more passive test where we are pressing the knee down to put additional passive stretch on these adductor group. And again, looking for pain or discomfort. The most common muscle involved in a groin strain is the adductor longus muscle, and the typical position of the injury is about 2 inches distal to its attachment on the pubic bone. So pubic bone here, about 2 inches down from that attachment, we're going to be able to palpate for pain or discomfort if that is in fact the muscle that is injured. For treating adductor strain using deep transverse friction, we can either use flats of fingers or a pincher grip to the affected tissue. If we are looking at treating the adductor longus, you're just going to bring your leg out a little bit this way and just slightly roll like this. Here's pubic bone, adductor longus comes like so. We can add a pincher grip like this and then draw the muscle up and down between our fingers, or do a little rolling motion like this to try to separate these fibers. Looking for the most tender spot with this. We can also just do flat fingers on the affected area if the pincher grip is too uncomfortable for the client. So again, we want to work within their tolerable range of discomfort, which is typically around a 7 on a scale of 0 to 10 for pain or discomfort. And the idea with doing transverse friction work is we are spreading those muscle fibers apart, trying to bring the healing process back into these tissues. This is the general treatment protocol for injuries to the lower extremity. In this one, with special focus on groin injuries. So we'll demonstrate some compressive effleurage and petrissage, some broad cross fiber work, a little bit of stripping, and then we'll demonstrate applying deep transverse friction to the injury area. I'm using light coconut oil for my lubricant, starting at the lower leg with compressive effleurage. Compressive effleurage is done with moderate pressure. The stroke is generally shorter and a little more vigorous than classic Swedish effleurage. Still trying to form my hands and fingers around the limb, easing up over the knee. And then because we're focused on the thigh, we're going to focus our broad cross fiber work first. If you have a client with groin issues, this may be too much for them. If not, if it is too much, then we would just ease off of the broad cross fiber work in the adductor area and work on the rest of the thigh. If this petrissage is too much for them, we would just ease off on that and move to the rest of the thigh. And then we'll start broad cross fiber work. We're doing broad cross fiber work to separate the muscle fibers in a way that they're not normally separating, since muscles contract in the longitudinal direction. We hypothesize that broad cross fiber will spread the muscle fibers apart to help break up any adhesions that might have formed between the fibers or between layers of tissue. Because we are dealing with a potential groin injury, the broad cross fiber work here may need to ease off or be much slower, or maybe we need to eliminate it all together. The same with all of these strokes. As we come up into the area where the injury lives, here's some stripping for the quads, because we're trying to reduce overall muscle tension in the whole thigh, even though our focus is on treating a groin injury. Because of your assessment and palpatory exam, you already know which area of the groin muscles you need to be working on. If you're in the belly of the adductor longus, doing some pincher palpation, drawing the muscle between your thumb and fingers will work fine. You may also, if that's not comfortable for the client, you could also do flat finger transverse friction across the most tender area of the muscle belly. You may have found that the injury is at the attachment on the pubic bone. With your client's permission, you would access that. Friction is applied with moderate pressure that you maintain in both directions of the stroke for up to a minute, expecting the tenderness to dissipate by the end of that 60-second first treatment. Following the deep transverse friction, a little bit more general massage to improve the relaxation overall of the muscles of the thigh and leg. And that's the treatment protocol for that.
Want to see more? Make sure to subscribe below and don't forget to hit the notification button.